Professor Young, can you give us a layman's update in terms of where things are up to with the development of a vaccine?
Absolutely. We're still in the preclinical phase, so this is the testing in animal models to ensure that the vaccine that we've developed is safe and shows efficacy. We've got to the end of one particular study that shows us that it's inducing exactly the response we're anticipating with very potent immunity, so that's looking good. We're also entering into toxicity studies to show that the vaccine is actually safe. And we've just delivered our vaccine to our collaborators in the Netherlands to test that it actually can induce protection against a virus challenge in an animal model. So we've pretty much got all of our preclinical studies up and running.
How confident are you that what you've got here will work on humans? It's sounding pretty promising from what you say.
It is promising. I mean, nothing's ever a guarantee until you do that final analysis. And by the way, those human clinical trials are still on track for the end of June or early July. But what we've seen so far in our animal studies would suggest that we're well on track.
We constantly hear about 18 months as the timeline for the development of a vaccine. How does that timeline look based on where you're up to now?
I think under normal circumstances, 18 months is still around about right. And I should point out that's 18 months from when we started, so 18 months from January. And the reason for that is that most vaccine development occurs in a sort of pipeline of activities. And it's a linear pipeline. So we have milestones that we need to hit. And each time we hit that milestone with a success, we move on to the next stage. And really, that has defined that 18-month timeline. Traditionally in the past, most vaccines have gone out to 5 or 10 years in development. So 18 months is still a radically short time. But what we've done recently is we decided to uncouple the last stage of vaccine development, which is the manufacture, and actually see if we could run it side by side with the clinical trials. And hopefully we're going to be able to cut about 6 months off that timeline.
So does that mean at the same time as the human trials, you'd be manufacturing vaccines, so if the trials go okay, you're ready to go straight away?
Correct. That's the whole idea. I mean, it's a hugely risky strategy, risky in the context of financially risky. We don't want to cut any corners in terms of safety and efficacy of the vaccine itself. But what we're trying to do is just ensure that we are ready to go once we know that the vaccine is safe and efficacious. And that takes us all the way through to even fill and finishing. So we've actually got vaccine in vials ready to deploy.
Well, I'm sure everybody watching has their fingers crossed for you and wishes you all the best. Thank you very much, Professor.
Thanks very much, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.